I'm Nadine Grosso with the Maine Healthcare Association. Maine nursing homes and assisted living staff have been on the front lines of the COVID-19 pandemic since the very beginning. And I don't have to tell you what a long, hard year it has been, but I do want to thank you. I want to thank you for caring for your residents and keeping them safe. Thank you for wearing PPE, working long hours, taking extra shifts, and making personal sacrifices with your own children and families. Thank you for showing up every day, every evening, and every night. And although it's not over, we are rounding the corner in this public health emergency. Positivity rates are going down, cases in long-term care are going down, and now we have a vaccine available. You and your residents were prioritized to receive the vaccine for all of the obvious reasons, and due to the nature of your residents, their risks, and your care settings. And we know that there's a lot of information to take in regarding vaccination. We also know there's a lot of misinformation to weed out. And while we hope for high vaccination rates in long-term care, at the end of the day, we know that this is a very personal decision, and it's really only one that you can make. Today, you'll hear from caregivers across the state who are going to talk about the impact that COVID-19 has had on them and their decisions around vaccination. You'll also hear from the Maine Long-Term Care Ombudsman Program on behalf of the families of the loved ones that you've been caring for so long. But first, I want to share a brief message from Maine CDC Director, Dr. Nirav Shah.
Hi, everyone. I'm Nirav Shah, the Director of the Maine Center for Disease Control and Prevention. And I'd like to take this opportunity to talk directly to you in your capacity and in your role as employees at long-term care facilities across Maine. And I'd like to encourage you as frontline workers in those facilities to get your COVID-19 vaccine as soon as it is offered to you. We've all seen, and you've seen, the sad evidence of how COVID-19 affects long-term care communities across Maine disproportionately because of a number of variables, including the close proximity of residents and staff, and the communal nature of long-term care facility living. It turns out that research indicates that although older individuals contract the virus less often than younger adults, older individuals are more likely to suffer harsher symptoms of COVID-19. Even the most robust, healthy person can get and pass on COVID-19. So even with strong infection control measures in place in all of your facilities, getting the vaccine is crucial to keeping you and especially the patients that you care for as safe as possible. Now, here in Maine, we are grateful for our residential care workers. You provide a safe haven and tender care for our most precious and vulnerable populations. You work long hours, multiple shifts, and your health and well-being are also essential. That's why getting vaccinated as soon as you can, as soon as it is offered, is so important. I'm sure you've got questions about vaccines, especially around the safety of them. Well, let me tell you that evidence has shown that the COVID-19 vaccines that are being administered and offered to you right now are safe as well as effective. There are few adverse reactions to those, and of those, most of those are among individuals who were already known to be at a higher risk for having an adverse event to vaccines. The trials that led to the authorization of both the Pfizer and Moderna vaccines showed that both of them are about 95% effective. Imagine that. 2 doses of a vaccine could reduce your chances of getting COVID-19 by 95%. I urge you to get your COVID-19 vaccine as soon as it is offered to you. Your health and well-being, as well as the health and well-being of everyone around you, will benefit as soon as you get vaccinated. Thank you so much, everyone, for all that you do.
I'm Adriana Royce. I work for the LAMP Memory Care Center in Lisbon for DLTC as a CNA and CRMA. So I'm right with my residents, passing medications and doing personal care. It was really challenging when COVID started because I would say it's very a lot of change and uncertainty. And I mean, every week was just different, and different rules, different regulations we had to follow in the facility. Masks, face shields, testing, more testing. And that is what I found very difficult. But when the vaccine first came out, I was not for it. I thought it was too new and I didn't want anything to do with it. And because I'm young, I didn't want it to affect me long term, because of I want to start a family and I wasn't sure about that type of stuff. So I ended up talking to a lot of other healthcare professionals and getting their input, their own personal research, and doing my own personal research. And I decided to get vaccinated. And I guess my biggest thing I'd pass on to other healthcare providers is that don't always believe in what you read on, like, social media or the other outlets. I would say do your own research to make sure you're making an accurate decision on what you believe.
Deb Otis. I work at Durgan Pines in Kittery, Maine. We are a partnership with Continuum Healthcare out of Lewiston, Maine. I am the business office director here. I do payroll, HR, many other little things. The biggest thing for me, the biggest challenge, I think, when this all started was it was very scary for all of us here. And then they started with the vaccine, and it was like, they're going to just give this to us. And, we had so little information. And unfortunately, I think the media has played a really poor role in all of this with the negative feed. So at that point, I absolutely was not, up until a few weeks ago, was offered the vaccine again at one of our sister facilities and decided to have it done. I just don't, I was very uncomfortable with the fact that it's only been like 5-6 months and they want you to have this vaccine. And you keep hearing this, that, and the other thing about it, the negatives about it. It's a little scary, I think, and it's a lot scary for all of our employees here too. We have had a good turnout with our employees, which is awesome. The reason, though, the biggest reason I decided to have this vaccine, because at this point I would not have had it, other than I have a family member in Florida who is on just came home in hospice care and is end of life. And I need to go see him, and I can't do that and feel good about it if I don't do a little more to protect myself and to protect him while I'm traveling, and to see him. So that was the biggest factor for me in having the vaccine. And at this point, I'm glad I did do it, because I feel very reassured hopping on that plane next week and going down there and seeing him and making sure that I've done everything I can do to protect me and him.
Amanda Blanchard. I'm a social worker at the Barron Center in Portland, Maine. I've been a social worker here for 13 years. For me, there have been so many challenging parts to the pandemic, the uncertainty, so many different things changing. It's very unsettling. Probably as a social worker, the hardest part for me about this pandemic is one, because you're masked, like to provide a smile for comfort, like in the times of distress, or providing those hugs to people that might be having a hard time. And also just the many difficult conversations that I've had with residents and families, very tearful about not being able to visit, That has been so super hard. We did have outdoor visits this summer and we're moving towards indoor visits, but it's really not the same. And just really all of those conversations and the emotional support surrounding that has been a big challenge for me. When they first started talking about the vaccine and everything, I was very ambivalent, skeptical, if you will. To have a new vaccine for a disease that's impacted our lives for a year and a half, depending on from the time frame from China and everything. I was like, this just seems really, really fast for that to be happening. And then you get inundated with different schools of thought on social media and the regular media and everything. So I reached out to medical professionals that I know and trust in my personal life, and talked that out and asked them, would you choose to be vaccinated and why or why not? And so ultimately, I did choose to be vaccinated. I've had both doses. And just what really burdened my heart, it kept coming back to all of those difficult, tearful phone calls and conversations with residents and families. And I saw being vaccinated as a tangible act of love and service towards the residents and the families that I work with. I'm young, I'm on the younger side, healthy and everything like that. But this is something I could do, that if there was even a prayer that it would liberate visitation and kind of return some normalcy into this setting, I was all in. So my advice would be, if there is that skepticism, fear, ambivalence, talk any of those things out with people that you know and trust in healthcare. Develop a pros and cons list to being vaccinated or not being vaccinated. And everything like that. We are being offered something that a lot of people in the general community are anxiously awaiting for, and that is a gift. I do not.
My name is Kasim. I am an LPN. I work at Gorham House in Gorham, Maine. We're in the same family as Daggin Pines, in Kittery, Clover, in the Auburn area. But I'm a long-time care nurse. I've been a nurse since 2012. I have most of my career I've spent in the Lewiston, Auburn area. I have been at Gorham House for about 3 years now, I believe. Time goes by when you work night. Obviously, it upended all of our lives, both at home and at work. And we learned to live with it. And luckily, the vaccine came through, and I honestly I didn't have any doubt of getting it. Yes, I grew up, my other part of my life I spent in Kenya. And, I am so used to having immunizations, vaccines. I have the TB vaccine, I have the polio vaccine, and I've all had them at my younger age. So this was very easy for me. Actually, Gorham House couldn't find a better person to bring down here because it was a very easy decision for me. And my biggest thing was just, getting our coworkers to get vaccinated. And I believe in science, and it has never let me down. Luckily, I think my experience has really helped me with this pandemic in so many ways. And here's the thing to all the healthcare providers, okay? If a 96-year-old with multiple problems can take the vaccine, you can get it.
I'm Ciara Lancaster. I work at Island Nursing Home. I've been a CNA here since 2013, on and off. I work in the office position now, but during our outbreak at the nursing home, I went on the floor as a CNA to help out again. I didn't really know how bad COVID could be until I saw it with my own eyes, and not the residents not having their families around was the hardest thing, to see them go through that alone with just us, minimal staffing because we got sick too. So when I heard about the vaccine, when I initially heard about it before we had it here, I was skeptical because I didn't know anything about it. And then after I saw it and I had COVID myself, I couldn't wait to get the vaccine because I just want to be a part of stopping the pandemic and doing whatever I can to keep everyone safe. So I think that anyone that has questions about it should really do their own research and talk to medical professionals to see the benefits. The shot for me, obviously you feel a little not that great after, like you would with any vaccine, but it was no worse than any of that. So for me, I am so glad I got it, and I want all my family and friends to think about getting it as well.
My name is Brenda Gallant, and I'm the Executive Director of the Maine Long-Term Care Ombudsman Program. First and foremost, I want to express the deep appreciation of Ombudsman Program staff, volunteers, and our Board of Directors in an acknowledgement of your courage, your professionalism, and your dedication to your work in providing care to residents in long-term care homes throughout the state during this challenging time. So many Maine people, the residents that you serve and their families, are extraordinarily grateful to you for the wonderful care that you've continued to provide through this difficult time. We know that deciding to be vaccinated may be a difficult decision for you, but at the same time, we believe that it's really the key to keeping you safe and the residents you serve safe. And we also believe that once the vaccinations are done for all of the residents and the staff, that this will really make a difference in opening up our long-term care homes across the state so that things can get back to normal, so that you can feel better about the work that you're doing. Families can begin to come in again, and we can resume as we were before. So we would urge you to get vaccinated. And to those of you who've already stepped forward to do this, we thank you so much.